You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, holistic dentistry. More and more people are looking for dentists that are having a holistic approach. With us, we have Arizona's go-to holistic dentist, Dr. Blake Shreeve. Dr. Shreeve, welcome to the program.
Thanks for having me.
Let's start with, give us a working definition of what a holistic dentist is.
Okay, holistic dentistry, that's a good question.
Okay.
So holistic dentistry, it's a little different than the focus of traditional dentistry. And let me explain why. So in a holistic dentist approach, we want to know the whole. That's the root of it. So traditional dentistry, you may go into a practice, a dental office. They may say, hey, you sit down, get some x-rays. They find out that you've got cavity. You get that cavity fixed, and then you're gone, right?
Okay.
And come back for your next visit where they tell you more. What we want to do is get a little deeper than that. We want to find out, why are you having these in the first place? We can fix those fillings, but let's try to get it where you're not having those anymore. Or your gum disease, what's the relation of that? How do we go deeper? Our approach is to help you systemically over your whole body, find out the root causes of the issues going on that are often reflected in the mouth. Most people don't know that 60 to 80% of systemic issues in the body, heart disease, diabetes, things like that, they have some sort of either cause or symptomology that you can find in the mouth. And so we want to help address that with people.
So one of those things, like for example, gum disease, and I've got a list of questions I want to ask you, but gum disease, bleeding gums, bad breath, loose teeth, this is something you take care of. You want to get to the underlying cause.
Right.
To kill the bad bugs in the mouth? Is that what you're trying to do?
Not just kill the bad bugs. I mean, that's ultimately our goal, right? You don't really kill bad bugs per se. We want to get rid of them as much, but your body's a balance. Right? So in your mouth, for example, talk about gum disease. Gum disease is caused by bad bacteria that's growing in where it's not supposed to. But what we want to do is obviously get rid of those, but the real thing is a balance between good and bad. When you have some sort of disease, it means the bad is winning out over the good. And so we want to restore balance. From our process, we want to go through and we're going to look into that, find out what the extensiveness is of these problems in the mouth. Okay, we're going to go find out where that gum disease is, what are those locations, clean those out. But beyond that, we want to arm you with things that are going to actually help you address this further on so it's not a recurrent thing. We don't want you to have gum disease for your entire life. Okay?
So it's a bacterial infection.
Gum disease ultimately is a bacterial infection. Yeah.
So if you eliminate this bad infection,
we have to fix the balance. So we eliminate it, and then we have to fix it so that your body can now maintain that balance between good and bad.
Let's start with materials. Like, what are the materials you use as a holistic dentist that are different than the traditional materials they use in a regular dental office?
Okay. With the materials that we use, our goal is to make the material as closely representative as the teeth as we can. We can't currently replace teeth exactly as they were, but we can do things that are biocompatible in the body. And so the filling material that we use, we don't use those old mercury metal amalgam fillings.
Are those still being used today?
They are.
Okay.
They are. Okay. They're decreasing in use, but they're still, I see them frequently. I get surprised every time someone comes in and they I just got these a couple of years ago. But predominantly people know, and now they're starting to switch. But we still get them coming in. We use fillings, even a tooth-colored filling are not all created equal. We want some of them have chemicals and things that also aren't as great. There's common ones like BPA is a one that you can be found in certain composites, and we are BPA free.
Okay.
So our goal is to find the things that are most compatible. On our crowns and bridges and some of those traditional things, similar. We want to avoid things that are irritating, that are going to cause inflammation or rejection by the body. We want to use things like ceramics, no metals, things that in the body, your body's going to like, it's going to tolerate. Not only that, it's going to thrive.
Now, we talk about backing up to gum disease for a moment, people with bleeding gums and the loose teeth and the bad breath, that oftentimes dentists will throw antibiotics at it. And the word on the street is antibiotics can be bad for you, destroy your gut lining, things like that.
Yeah.
Are you trying to avoid antibiotics whenever you can?
We avoid whenever we can.
Okay.
I think there's a time for antibiotics, and that time is when you have some acute, big time, swelling issue. Most gum disease or other diseases in the mouth, they're more of a chronic issue. and it's an imbalance. There
So
are
you
other,
can treat that naturally.
you can treat that naturally. We have in our office, we use some what I'd call alternative non-pharmaceutical treatments. They're more natural, they're holistic.
Now, what about fluoride? What are your thoughts there?
I'm not a big fan of fluoride. Fluoride, we know now through lots of papers that have been done, research that, and just time since it's been in use, that it leads to a lot of chronic issues, problems in bones and kidneys and things that I'm not sure that it's worth it. We have better things now that we know the way that the bodies and cavities and things form, that we don't need to try to sugarcoat it with something else that could cause additional problem. Let's go to the root of the cause.
People need to know that the medical doctors in the know, they all say the same thing.
Yeah.
In fact, they tell me, Randy, you've got to find a holistic dentist. So is it biologic dentist, holistic dentist? Is it just the same?
It's pretty much a synonymous term.
Okay.
It's the premise is holistic. Sometimes we use biological. Holistic sometimes gets a bad rap in the way, it seems like, you're going to have burning incense in the corner, and then you're going to be wearing hippie clothes and things like that. And so in reality, it just means whole, right? The wholeness of evaluation. Biological, we talked about the materials that we use, the things. That's the premise of biological dentistry, is when we put something into the mouth, we want it to be the most current, most biocompatible material that is available now. It's a growing area. We keep changing and finding new things. I'm really excited about the future for it. We've got great products now which weren't available even 10 years ago that we can put in that don't create those problems that some of those early things did.
Now, you do a different kind of a root canal, a more holistic root canal, because, on the internet, everybody's talking about dangers of root canals. So, first of all, what is it? How is it normally treated? And what do you do?
Well, root canals themselves, the reason for a root canal is that tooth has become infected or damaged inside all the way down to the nerve, which is the center of the tooth.
Okay.
Once infection hits the center of the tooth, that nerve, the tooth is dead. There's nothing left of that.
Is that right?
Tooth.
So they're dead.
It's dead. It's dead. Or it's when you're in pain, it means it's on the way out. It's like the last screaming breath of
right?
life.
Okay.
And that's why it's painful. And so that nerve is dying, it's dead. There's nothing more you can do to restore it. It becomes an irreversible situation. So they put a sealer material in there, first of all, to fill that up. The problem with them actually is it's not cleaned out all the way. With our current technology, we are not able to clean a tooth out 100%. There's always dead tissue left over.
Okay.
That dead tissue becomes a source for bacteria to live in, and they can become a source of toxicity. Your body can't get to it.
So in this root canal, it's like a portal to like your blood system?
It's in your body, right?
Okay.
So you've got a tooth. There's little holes that run from the middle, little tubes actually, that run from the middle of the tooth to the outside of the tooth, okay? And during a normal healthy tooth that's not damaged, there's fluid constantly flushing in and out. It's like a tooth flush.
Okay.
Well, when that tooth dies, that flush stops.
Because they plug up the hole.
Because there's no more pressure inside
Okay.
to relieve that. It's a pressure thing with the tooth. That flush stops. That means your body can't get in any healing immune response to any bacteria in there. There's no blood flow bringing blood in there. It's dead inside. You basically have a dead area in your body. Around that tooth, that tissue, bacteria love it because you can't get to it. Your body, all those immune cells that are trying to get rid of the bacteria, they can't get to it. For some people, that can become a source of toxicity. That can leak out through those tubules into the body, create inflammatory responses, issues. And for a lot of people, that can become problematic. A super healthy individual may not notice any issues at that time. Someone who's immunocompromised, they could have a lot of things. So the most difficult thing is we don't have any current health test to monitor and say how much or how little is this bothering you.
So what's the answer? So what do you do as a holistic dentist?
As a holistic dentist, we want to get rid of anything that can cause problems. So the solution in general is to not try to run the risk that tooth could become toxic to the body. We want to get that toxicity in that tooth out. You're left with a hole. So what do you do with that hole? Our solution is to put in a ceramic implant generally, or a bridge, or even leaving the tooth at open space, although not ideal. in a lot of instances would be much better than maintaining a toxic tooth if that ends up being the case.
So, look, I've had other dentists that tell me, philosophically, they say, look, Randy, you have a root canal is a tooth that's dead. It's causing infection. If you remove it and give them another tooth with an implant, they're better off. But that's frowned upon in some cases.
It is. I had a patient this week. Let me share this with you.
Okay.
So this patient comes in, new patient to my office, older woman. She comes in and she's got a stack of medical records with her. It's literally about this thick. And she starts going through her history. She was diagnosed with breast cancer previously. She'd had a mastectomy, and I think she had somewhere between 12 and 22 lymph nodes removed.
Okay.
So after this discussion, when she comes over there, we generate our plan for her. What's our plan? Same thing I'd recommend to anybody. We talked about removing those root canals, which was her main thing coming in. We also discussed some of the other things in her mouth that could benefit her in decreasing those inflammation and things. But our plan is to remove those root canals and either to put in some ceramic implants, to put in a bridge, which is we'd use a biocompatible ceramic bridge material that's coverings over the teeth to fill in a space.
So no metal on these bridges?
No metal. We avoid metal. Okay, metal's reactive. So after that, we can do the ceramic, we can do the bridges, and she may choose to just leave those spaces there. We love to fill in spaces. We love to have everything balanced.
So the goal is to get rid of all the infection.
We want to get rid of the infection. We want to get rid of things causing inflammation.
And the source of the infection.
And the source. Okay.
Interesting.
And so that's the premise. This was sent to us by her medical physician. Okay. So these are the kind of people that we want to help. We want to see. It's something that's becoming more well known. And we feel like we have something to offer for that. So what we feel is once we remove these areas, she's got a couple things going on. We're going to remove the root canal areas. She's got some old metal crowns in her mouth that are reactive. She's got some mercury amalgam fillings, all of those things that we discuss in holistic dentistry. When we remove those, she's going to be able to have healthier gums. She's going to be able to have a healthy environment. She's probably going to have a whole lot more energy and a little bit more excitement towards the future. But I'm willing to bet when we're done, she's going to go in and get that thermogram done again, and it's going to be clear.
It won't be lit up.
It won't be lit up. We're going to have eliminated that big cause, which was the largest area showing on that scan of inflammation in her body. We're going to be able to get rid of that, which is going to just help her and her body to heal itself, to continue on that path, healing herself from that cancer.
You mentioned dental implants. If you're going to replace a missing tooth with a dental implants, you're not a big fan of titanium. You like ceramic dental implants.
Yeah.
Are they strong enough? And why isn't everybody using them? And isn't it still a metal?
So let me address all those questions.
Okay.
I think they're great. So ceramic implants is definitely the way I would go. Overall, we try to avoid metals. Metals tend to have reactivity, they have responses, and they create chronic inflammation in the body, which is something we don't want. So ceramics don't do that. They're extremely biocompatible, and it's the new wave. Every major implant-making company is coming out with the ceramic implants. They've been around for a while. They're just making our way to the United States. We kind of use them over in Europe as our proving ground.
Okay.
They've been around for 20 years. They're great. The ones we use predominantly, they have the highest quality cleanliness, which is a big deal. You want them to be clean, and you want them to be not introducing things into your body. The ceramic implants are equivalent to the titanium implants. They function a little differently. They're very technique sensitive is what we'd call it in the term. So you definitely have to do it in the right way. Not anyone can just throw it in there. You got to make sure that the environment is good. And that's why...
So it's the ultimate way for tooth replacement.
It's the ultimate way that we have currently.
Instead of having a dead tooth in your mouth with a root canal,
right.
Remove that tooth, give them a tooth back
ceramic implant.
with a ceramic
implant.
implant.
The body loves it.
Okay.
I placed, in the past, before I knew better, I placed tons of titanium implants, thousands. And people, we know now, I mean, you can do a little Google search real quick for research articles, and you'll have thousands about periimplantitis and all of these issues that arise from the metal reactions. The ceramics, I can place a ceramic implant in someone's mouth, and they'll come back a week later, and it looks like it's been in there forever. The gums are completely healed up. They love it. They actually adhere to it, whereas on a titanium implant, they can't.
Okay, as I'm listening to this, learning about this as well, So the acupuncture group, acupuncture is now mainstream, right? But they're worried about this or not worried about, they work on this invisible system, the meridians. So metal in your mouth would throw off your chi, your energy system. Is that kind of the thought here? Is that what I'm picking up on?
The energy is really important for the body. A lot of people don't think of us as energy related, but we really are. Our nerves, they fire at 70 millivolts of electricity. That's how we get, I mean, if you've ever touched, you got that static zap and you can feel it radiate up your arm. The reason you feel it run up your arm is because it's running through your nerve system.
Okay.
But that's how your body functions. When you put in metal into the body, it's going to act as a conductor for those, just like a metal wire.
So it kind of throw off your system a little bit?
It throws off your system. It throws out your whole energy function. It can drain people. They can actually act as an energy drain. The more metal you have, the more draining it is to your body and your physical energy, because that's how they run.
Are there published articles about what you're talking about? Look, I'm not an expert, but could an expert sit here and say, I don't know if that's true? It's definitely true, and there are research articles that show that. One of them, there's a Dr. Scott Schroeder. He's a foot and ankle surgeon, and he actually went before the FDA in, I think, 2019. You can YouTube him. He gives a great explanation of this reaction and what's called galvanism, this reactivity of these energy flows in the body that cause between metal. He went up petitioning the FDA for improving the types of non-reactive, non-metal implant type devices we have for orthopedics. For like knees, hip replacement,
hips,
things like
screws.
That. Ceramic is kind of becoming the new trend.
It's the trend right now because it's the most biocompatible, and that's what we have right now. You asked a little earlier about, aren't they metal? The ceramic implants that we use, they're zirconia, and zirconia is a metal. The difference on a ceramic is the process of making them. They actually, the way that it's created, it takes away that reactivity of it. It becomes what's called inert, and so it doesn't react to those processes.
So it doesn't throw off your chi.
It doesn't throw away the chi.
Like that.
It doesn't affect those meridians the same, ideally, is what we're looking for. We want to make sure it's the most current biocompatible thing, that your bone likes it, your gums like it, it's not having that metal reactivity that sets all those energy reactions off, and overall, the patients respond really well. Here's an example of just one patient I had, if you don't mind.
Sure.
So I had a lady. She was a patient of mine, and this was a few years ago. I had put in a titanium implant because that's what we had at the time. It's the most commonly used implant. Put in a titanium implant, never felt right to her. All the scans show it perfectly placed. The bone had grown in, the gums, nothing completely visible saying, hey, this is a problem, but she just couldn't tolerate it. Comes back a little while later and started to show some problems with the gums and the tissue.
Okay. And
we realized that this implant was failing. Couldn't tell why, other than it was just a metal implant. Now we have these ceramic implants. So we take out that titanium implant, we place in the ceramic implant. She comes back, she's like, I feel amazing. I feel so good. This is great. It didn't hurt at all. We removed it. We put in an implant, surgical procedure. It's like, I didn't have pain. I didn't have to take anything for pain. It never felt this good with the other implant. I'm so glad we did this. It's non-reactive. Now I want to mention pain. This was her experience with that. I'm not to say that anyone getting a ceramic implant isn't going to have pain. But
the discomfort procedure is minimal? It's
not
something they complain about?
The thing about it is generally the patient responds better to these materials because you're not having that same inflammation, irritating response that the metals do.
Now, moving right along to the next topic, I got to ask you about airway.
Okay.
What is a dentist, and how does airway play a role in holistic dentistry?
Okay. First,
like sleep apnea, things like that.
Sleep apnea, other airway resistance issues, we call them. It's core for us. A dentist as a whole, we focus on the head and neck area. And so the airway is part of that, right? Right behind your tongue is the airway. It's an area that we focus in. What's the big deal about airway? When you have narrow jaws, when you have a tongue tie in there, it's going to push things back into the airway. So people struggle with sleep apnea. A lot of people are having to wear CPAP machines or have other issues during the night. they're not sleeping well, or they don't even sleep in with their partner. They have to sleep in separate
Because
rooms
of the loud
because of
snoring or
snoring
breathing.
and
Okay.
things like that. People are grinding their teeth. That's an airway sign. It's an issue that your body can't breathe.
And that's all fixable, you're saying?
all fixable.
Okay.
It's all fixable. You don't have to be dependent on some of these things to correct these issues. The problem that we find with airway, your body needs basically three things. It needs air, water, and food. You can go 2 weeks without food. You can go 3 to 5 days without water. You can go like 3 minutes without air, and you're running into big problems. People don't often realize, because it's their norm, how much just a slight discrepancy in how they breathe can affect their health dramatically. For example, mouth breathing alone. Okay, you have an underdeveloped jaw, so you have an underdeveloped nose inside, so you can't breathe as well through your nose. Your body's going to default to the mouth. Okay? You become a mouth breather. It's one of the worst things you can possibly do for your body,
So what do you do to
health-wise.
correct it?
So what we can do, traditionally, for diagnoses of sleep apnea and things, the CPAP was the go-to, but people can't wear them. They don't tolerate them well. Most don't. And it's just addressing the issue.
So some
at
people
night.
can't wear them.
Some
I think you
people
told me,
can't.
60% of the people can't even wear them or don't like them.
In fact, it's even higher after 5 years. A lot of them end up in the closet, and that's how they end up in my office too.
I mean, they're
for treating
effective,
airways.
but the problem is people don't like them.
All right, they can be, they're very effective at getting rid of the signs of sleep apnea. There are some issues with them though. First of all, they don't correct the issue, so you have to wear them every night. Okay, it also is blowing constant air down your throat, which can irritate the nasal tissue and a whole lot of things like that. They had to recall some CPAPs because the CPAP airway, the filter wasn't working right, so whatever was in the air was getting blown down in the bottom of the lungs. So they can be very good for people, especially with severe apnea, that need just urgent help on that. We have an alternative though. What we can do is it's a dental anatomical thing. The reason that person isn't breathing as well, or they're having these apnea events, is the airway's closing off in the back. So what we want to do is to grow that airway. We can actually do that. The growing of the airway is simply the fact that those jaws on the people, or some of the facial structures, they're not in the right position. The way we address it, whether it's through dental work or repositioning appliances or growth appliances and orthotics, we can fix that airway. We can get it to where that problem that person was experiencing is eliminated, possibly eliminating from any need of CPAPs or
So they
whatever
can
else.
sleep like a solid 6 or 8 hours or whatever.
6 or 8 hours.
Wake up with energy.
Wake up with energy. They're not getting fatigued during the day. They're able to go play with their kids in the evening when they get off of work. These are big deal. It decreases their risk for diabetes, Alzheimer's, heart disease, high blood pressure. All of these are directly tied to airway issues.
Tell me this. Now you said something to me, and by the way, we have like a couple of minutes left.
Okay.
But I asked you, so you're a holistic dentist.
Yeah.
I said, well, why is it we're pulling out wisdom teeth if God made it to where you're supposed to have those teeth? Why all of a sudden now everybody needs orthodontics? When they look at mummies, they had straighter teeth. And you had an answer that logically made a lot of sense. And I've been telling a lot of people ever since you told me. So share that.
So it seems almost like a teenage rite of passage to get braces and get your wisdom teeth out.
Okay.
If you go back 300 or 400 years ago, that wasn't the case.
They had straight teeth.
They had straight teeth. Archaeologists have, they study the skulls, and you go into any of those museums and they all have perfect teeth. They all have room. Genetically, we're programmed to have room for all of our teeth, including the wisdom teeth. The problem is that culturally, some of the things we do, soft foods to babies when they're young.
Baby food.
Baby food. They should be on harder foods. It strengthens the muscles and drives the growth.
Like little carrots
Like
or
carrots
broccoli
and dried meats.
and it opens up their...
It strengthens the muscles. And on a baby, babies, they have their soft heads, right? You bring them home, they're little infants, you have to be careful. The thing that drives that bone growth is the muscles. The way we go about treating our kids, we don't strengthen those muscles. We don't breastfeed as long. We have bottles, we have pacifiers.
Yeah, less and less people are breastfeeding.
All of these things. And some people can't, but it's a benefit to the child. As the baby's feeding, it's pulling the jaw. When it's eating those harder foods, it's actually strengthening the jaw muscles, which then drive the growth of that airway, the growth of that jaw. So those people they're not going to grow up with those narrow jaws.
So
they
the
probably
babies
won't
of
need
500
braces.
years ago were not eating baby food.
They weren't
They were
eating.
eating chewy things?
They
Is
were
that-
eating
is that
chewy
the whole
things.
premise?
The real problem,
Which opened up their airway.
it opened up their airway, and it gave them all straight teeth. They didn't have orthodontists back 300 or 400 years
Okay.
ago, and they've all got straight teeth. So some of the things that we do end up causing our own problems that then we try to correct.
We are completely out of time. We probably have 1 minute and 30 seconds left.
Yeah.
I want to talk to you about TMJ problems, people with migraines that are associated with a TMJ problem.
Yeah.
This is your area as well. You
Yeah.
treat that
We
with
absolutely
success?
Yeah, with success. So we treat TMJ. TMJ is related to the same things that airway is that jaw is mispositioned, which can dislodge the disc and cause pain. People experience in a lot of ways. Sometimes they can't open, sometimes they can't close, sometimes they just have pain, rating
What about
heads,
popping and clicking?
headaches. Popping and clicking, there's a little disc there that's displaced. So when you start to open, it clicks back in.
You could fix that?
I can fix that, yeah. Within reason. I guess I should clarify. We can improve it and at least make it better for a
And the
patient.
symptoms
Sometimes
could go
I
away.
can fix it. Depends how long and a few other things. But the symptoms go away. We can get people out of pain, get them functioning. Their headaches, we can decrease those that are caused by that because it's all positional. So we can improve that. I had one lady. She came in and she could only open this far. Not kidding. She's a cute little sweet old lady. Her husband would have to help usher her into the chair. Couldn't even open. So we did some special orthotics for her, recaptured those discs that were displaced, and she ended up being able to open completely normal, which was a game changer. She was having to eat through a straw. And so these are things that we can do. We can get rid of that clicking, popping. People don't have to live with it. It's something that we can treat, oftentimes tied to airway issues too. It's all connected.
Good.
Just like holistic dentistry.
So insurance,
all
I mean,
connected.
you say that you accept insurance and you try to get every penny out of the insurance if they have it.
Yeah.
So you'll work with them.
Yeah.
And so holistic dentist. Doesn't cost more to go to a holistic dentist to use these new materials.
It should cost less.
Okay.
So because when we go in, you get the treatment done, but we're helping you try to avoid any future treatment. So no difference from another dentist on the things that we're doing. The approach that we take, we just try to make it in an improved way.
Okay.
It's like Dentistry 2.0.
So we're out of time. If they want to make an appointment, they call you directly, go to the website. What do you prefer?
They can do both. So visit our website, call our office. We train our staff. They can answer a lot of your questions too. If you want to come in, see me, I'm there for you. So,
All right. I want to thank you for coming to the show. Great stuff.
thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.